I might have to go, but
No sweat.
I might probably.
Can you just
tomorrow
really
to explain
quickly do
this.
the, just go over the top,
The top. What do you mean?
the top, the thigh,
The thigh.
the thigh.
All right. So here's the sartorius.
Right,
Sartorius is the seatbelt of the leg.
right, it goes, it's the longest muscle, goes all the way.
And so when you sit up and cross your legs like so, that is all sartorius. So the sartorius has three functions. It'll be to flex the hip, flex the knee, and externally rotate the hip, crossing your leg. So there's three muscle actions going on. Externally
Cool.
rotating the hip, flexing the knee, and flexing the hip. That's all sartorius. All set?
I should stay, but
Oh, I should probably let him go on the last one here.
No, you guys can stay. Don't worry about it.
Yeah.
Well,
My time is your guys' time. It doesn't matter to me. It doesn't make a difference.
okay, well, I'll stay till you finish, so you can be kind of quick, and I'll ask you on Friday if you're here again.
Sure. And so when someone talks about the quads, they're talking about the four muscles in the front of their leg, front of their thigh, and there's going to be one rectus and three vastus. So there's going to be rectus femoris. So it's right around the femur, so it's femoris. And what it'll do is it'll erect the knee or straighten out the leg. So that's this guy right on top.
Right.
Now you have three vastus. You have vastus lateralis, vastus intermedialis, and vastus medialis. Lateral, in the middle, and medial. Now we're talking adductors, things that are going to bring the legs together. So, again, there's going to be three. There's going to be one super big one long one, and one super tiny one. Let's start with the small. So, adductor brevis means brief or short. That'll be this guy that's right here in that little crevice, the little triangular shape.
Yeah, the brevis and the crevice.
Yep. And so, more lateral to that will be the pectineus, which is not, it is an adductor, but it's separate from the main adductors. So, pectineus. So, that's pectineus.
Do you mind saying it?
This is pectineus.
Okay.
This is adductor brevis, right in the crevice. This is adductor longus, this long-shaped one. This is your gracilis. And then you have this massive, massive adductor, adductor magnus, which is so big that it actually folds over on itself. So if someone puts a pin there, it's adductor magnus. There, still adductor magnus. Even still adductor magnus. It's all this. And if they were so adductor magnus, one of the terms is actually the adductor hiatus. So when a teacher says I'm taking a break or I'm taking leave of absence, they say I'm going on hiatus. So it means like a break or a little time off. So the adductor hiatus is a break in the tendon, and it allows for your femoral nerve, artery, and vein to pass through. So come to lab, there's a pin right there.
And that'll be the hiatus.
That's adductor hiatus right there.
And that's with the nerves.
Yeah, so
It's
what
where
it
the
is,
nerves, it's the hole in the ligament that the nerves and everything go through.
Okay.
hole in the tendon, because
Tendon, excuse me.
ligaments
Right.
are from bone to bone, tendons are from
Yes,
muscle to
yes,
bone.
yes, yes.
And that's really important because, this femoral nerve, it's going to branch off and go down the rest of your leg. If that somehow gets damaged by being closer to the surface, then you could be potentially paralyzed. So you want to get that as deep into the leg as possible to prevent, to give it some extra cushion of. So this muscle can get damaged before that gets damaged. So we went over, this is gracilis, all adductor magnus, adductor longus, adductor brevis, and pectineus. Now, what's this one?
That's the psoas, right?
It's part of it.
Psoas major?
Part of it. So, I'll show you real quick.
Yeah, because it comes down from there, from the
So have you-
iliacus and the...
Have you ever had tenderloin? Like a
Yeah,
pork tenderloin?
yeah.
All right, so when they say... Hopefully you don't open up like that. So, your tenderloin, or the cow's tenderloin, is their psoas major. The long, tubular, columnar shaped muscle that for cattle or pigs doesn't get a whole lot of motion because they're not kicking and running very fast.
Oh, it's the iliacus. Okay, go ahead.
So it's not the iliopsoas, it's actually just the psoas major.
Okay.
And so it's right around here. That's going to be your psoas major. Now you ask if there's a major, there's got to be a minor, and there is a minor, but you won't be able to see on the model, and you'll be able to see it very clearly in the cadaver lab. If we were to move this, there'll be a tiny little similar shaped segment underneath, and that'll be the psoas minor. More laterally, you have this broad shape this coming off of the iliac crest. That'll be your iliacus. Now, when those two drop down through the pelvis, they kind of morph together into the iliopsoas.
That's what I was meant. The iliopsoas. That's what it
Which
was.
you can see right here.
Yes.
Did you guys learn about the inguinal ligament yet? The inguinal ligament?
I know it's the divider line, but it's.
So it is an important thing. So when someone says they have the six-pack of their abs, that's because there's this covering that pinches off at certain points, and that allows for different compartments of their abs. So at the end of this compartment, it kind of rolls up on itself, this connective tissue, into a tube, and that's called your inguinal ligament. For guys, it's really important. For girls, it's really important, both in different ways. So for guys, it's really important because it forms a tube, and what will pass through is the spermatic cord containing all the blood flow and nutrients to the testes. And if a male says he's having a hernia, it's because they're not here anymore, but the intestines, because part of the intestines, which sit right about there, have protruded in through the inguinal canal and into the scrotal sac, putting extra pressure on the testes or cutting off blood flow. Now, for girls, it's really important because what goes through there is, I believe it's the ovarian or round ligament, but basically what it'll help to do is to help anchor down the uterus to the front labial wall. And so that'll be what some people kind of today kind of colloquially say, like, it's the V. That's right, the wedge right there. That's your inguinal ligament.
Okay.
And so not only does it look kind of cool on someone that's like really fit, but it serves a really important purpose. So inguinal ligament, iliopsoas, iliacus. Posterior thigh. All right, real quick. What we got right here?
Gluteus maximus.
Gluteus maximus. Inside?
Gluteus medius.
Okay, cool thing about the gluteus medius. There's a condition called the Trendelenburg gait. Now what that means is the gluteus medius is not working properly, whether it's nerve damage or just damage to the actual muscle itself. Now what the gluteus medius does, it's an abductor, so it helps pull out your hip. Now why that's important is that when you're running, it helps to keep your pelvic straight. So here's my gluteus medius on my right side. If I relax it, it's relaxed right now. This leg droops down because my pelvis is dropped down and it stops it. And if I flex it or contract it, it straightens everything out. So someone that has nerve damage on the opposite side will experience a leg drop on the opposite side.
Okay.
So when someone has Trendelenburg gait, what that means is that when they're running, their pelvis kind of goes up and down all around. And what that means is that while they go up, this leg kind of droops down. So to stop from kind of flopping down their legs, when they run, they kind of swing their legs around to compensate to stop from running the ground. So when I'll show you this video, check this out. It's kind of slight, but you'll be able to see that this person's, first of all, their hips flopping all over the place. And you can see that their legs aren't running straight back and forth.
Is that something you're born with, or